Adult Basic Life Support. High-quality CPR for healthcare providers. Remember the chain of survival. Assess. Activate. Compress. Defibrillate. Step 1. Ensure the scene is safe before you approach. Step 2. Check responsiveness. Tap the shoulders and shout, "Are you okay?" Step 3. Activate emergency response and send someone for the AED. Step 4. Check breathing and pulse together for no more than 10 seconds. Step 5. No pulse? Begin high-quality compressions immediately at 30 to 2. Step 6. Use the AED, attach the pads, clear the patient, shock if advised, then resume CPR. Step 7. Continue cycles and switch compressors every 2 minutes. For high-quality CPR, push at a rate of 100 to 120 per minute. Press 5 to 6 centimeters deep. Allow full chest recoil. Minimize interruptions. And keep a 30 to 2 ratio. Remember. CAB, compressions, airway, breathing. Subscribe for more, and always train with a certified course.